Okay, we're gonna have a look at Sever's condition. So if you go back here to our website, you'll see under common conditions, kids heel pain. So we'll click on there, and we have information about Sever's condition. Now, Sever's condition or Sever's disease is a condition that occurs mainly in children or teenagers, and the symptoms normally is pain around the heel area during or after physical activity. So, let's say if they're playing a game, they'll start to get pain towards halftime or towards the end of the game, or even sometimes they'll be fine during the whole game, and then after the game, they'll feel pain around the heel area. And it worsens after exercise. It is tender around the heel area. Sometimes the calf muscle can have a little bit of stiffness, and sometimes kids can sort of tiptoe or raise the heel off the ground for them to take pressure off the heel. Now, what is it caused by? First and foremost, it is caused, Sever's disease is a common condition. It is caused by pretty much the heel bone tearing away from the growth plate. And a common cause of heel pain in young and active people between the age of 8 and 14. Why between these ages? Because the growth plate is considered open in the area. So what happens if you look at this picture here? This is an x-ray of a child. You have the heel bone, you have the growth plate, and then you have what they call the apophysis, or the sort of extra area of the heel bone. Now, as a teenager turns into an adult, these growth plates close. This becomes one bone. So look at it like a biscuit, right? So if you've got the hard area, and then you have the soft area here. Then at the back, you have the Achilles tendon that attaches to this area. So when it pulls, it's going to pull away from that growth plate, causing pain and discomfort. There's another photo there. You can see pretty much the Achilles tendon as it runs, it pulls on the bone, tearing it apart. And it is very painful, and it can fracture at times. So this can lead to what we call a Salter and Harris fracture. So pretty much what can happen is the biscuit, the cream within the biscuit can tear, right? And that leads to a displacement or a fracture. If that's the case, then unfortunately patients need to be in a cast. However, a lot of times you can actually prevent that. So if we go back to Sever's, we can actually prevent that by treating it. Now, treating it has a couple of different options. If it's very mild or very acute, then we can use conservative methods, like for example, strapping, icing, and things like that. However, if it's sort of a bit more pronounced than that, then a common way of treating it is through heel raises or orthotics that go inside the shoe. So a child with pronation height, so we look at if the child has flat feet, if they have other conditions, we try to alleviate the pressure from the area by either making orthotics, heel lifts, and the treatment is quite successful. So if your child is suffering from Sever's condition, then make an appointment and get it assessed.